Good afternoon. My name is Sharon Nachman. I am a professor and the Division Chief for Pediatric Infectious Diseases at Stony Brook Children's Hospital. Today, I'm joined by Dr. Jill Chaffee, the Medical Director of our Ambulatory Primary Care Pediatrics, and Dr. Lauren Ng, also from Primary Care Pediatric. Today, we're going to be talking about vaccines. As we continue to battle against the coronavirus and approach our flu season, it's imperative that we know the facts about vaccines. So we're going to be discussing the importance and the science behind some of these vaccines, as well as working hard to dispel a lot of the misconceptions, the myths, and address concerns surrounding some of these key vaccines that your children are getting. We're going to touch on COVID, the flu, and human papillomavirus vaccines, just to name a few. So first, let's start by some terms that we hear people talking about all the time: immunizations and vaccinations, and why they're important. Well, immunization means that you're immune to a specific infection. Vaccination is often the way you get to it. We really don't want you to get that illness and then be immune. We'd rather prevent it up front. So I'm going to ask Dr. Chaffee to talk to about what are some of the vaccines we typically use in children and why do we use them?
So hi, everybody. I have been a pediatrician for over 20 years, and I have been working with families to vaccinate their children during that time. I just wanted to say that Dr. Nachman is correct. Vaccines are used to prevent infection. In fact, many of the diseases that we actually vaccinate your children for are diseases that we don't want them ever to get, and that can be quite dangerous if they do get. So we start vaccinations and the talk of vaccinations right at a child's birth. It's important from the beginning for you to know what your child is being vaccinated for and why we pick certain time periods to actually vaccinate your child. So babies are very prone to having very low immune systems. That's normal and common. And so we aim our vaccines to very young children for a reason, and that is to prevent illnesses that can really make them incredibly sick and could perhaps put them in the hospital. So many vaccines start either in the newborn period or within 2 months. At 2 months, we start trying to prevent diseases that are common, that we know still exist. They're diseases that can cause whooping cough, diseases that can cause tetanus. We have vaccines aimed for newborns and 2-month-olds that prevent hepatitis. I try to tell parents that it's not a time to wait. We know that these illnesses do exist. And in fact, some of the vaccines, even though I've been practicing for 20 years, didn't even exist when I first started practicing. So some of these illnesses really we have seen as doctors, and that these vaccines are really helping children to stay safe and healthy and to be part of a larger community of a family with children who potentially go to school and bring home some of these illnesses, and mothers and fathers who work and also are exposed to illnesses. So we really protect babies from the environment and from getting incredibly ill. Vaccines are aimed at the very young periods, and a lot of vaccines are done for their first shots by the time a child is 1 year old. There's also another period of time that we immunize our patients, and our parents are very familiar with this, is that for school. So each school district also, and each state has mandates in terms of protecting the students and everyone in the educational community from disease. So the second time that we really have a push to vaccinate kids is prior to their entry into a school environment. A lot of times these are shots they've already gotten when they were younger, when they were the most vulnerable. But we also want to rebooster them so that when they enter the school community, they are safe from their fellow classmates, and also they aren't spreading disease themselves. So we do boosters prior to entering either pre-K or kindergarten. Most of these are mandated by the state. And again, most of these vaccines have already been given when they were younger and the most vulnerable. The next time that we vaccinate again are for adolescents. Some of them vaccines given at that time are again booster vaccines, protecting again from things like whooping cough and tetanus, which we know still are in our environment and it's very important to protect against. We also add new vaccines that the teenage population is vulnerable to, such as meningitis. So at that age, we're also preventing the diseases they're most likely to get sick from and become potentially hospitalized. And then the last time that we vaccinate our patients is when they're going off to college. Most colleges recommend meningitis shots because dorm living and living communally in colleges can spread meningitis. So we, again, vaccinate our patient population prior to college. Those are really the big time periods that we vaccinate kids. And certainly there are other times if families are choosing to travel or to go to different places. Sometimes those places have other illnesses that are being spread that we try to protect our patients from. So those are the largest times. And vaccines keep these kids from actually getting the illness. It's a very proven way of keeping our patients safe and our communities safe.
Thank you very much. And it's interesting that people think that vaccines are only something we give to children. In fact, the ACIP, the group that helps us understand which vaccines to use at what time, also recommends vaccines for adults. So even before COVID hit, there were vaccines that we used for adults as well. Some of them, like tetanus, when you had a cut or were in some accident, you needed a tetanus booster. And some of them, like the pneumonia shot that we give to adults, help prevent pneumonias among those adult patients as well. So vaccinations, even before COVID, were not just for infants, children, and adolescents. They were actually for everybody as well. Let's move ahead for a minute and talk about the elephant in the room, the COVID vaccine. I've often been asked, is it safe for kids? Is it safe for adults? Who can get it? When can they get it? Which one is better? And the answer is, it's a lot of gray answers, not always black and white. The easy black and white answer is yes. The COVID-19 vaccine has been given to over 100 million adults worldwide at this point. And if that means anything to you, that means that in fact it is safe and it is effective. Here at Stony Brook, we unfortunately are seeing more and more adults being hospitalized with COVID on a daily basis. And we ask each one of them, did you get vaccinated or not? Not surprising, pretty much 100% of the people that were admitted to the hospital were not vaccinated. That tells us the COVID vaccines here on Long Island are working for those that have gotten them. Well, what about kids? Kids need to be vaccinated for COVID too. If you had asked us a few months ago, do kids get COVID? The answer is yes, they do. But we're happy to say they don't often get sick. The Delta variant seems to have changed that a bit. And if you've been looking at the news from Florida or Mississippi or Texas or even Kentucky, they're all talking about pediatric cases or children getting COVID. Not only getting the infection, but getting sick with it. And right now in Texas, there are no pediatric ICU beds for anyone at this time. They're all filled because there are too many children who have COVID that are being admitted not only to the hospital, but to our pediatric ICUs. So we really want to prevent it. How are we going to prevent it? First of all, by vaccinating adults. And second of all, we want to say, well, where are the vaccines for children? Both Pfizer and Moderna are right in the middle of doing clinical trials in kids under age 12, even as young as 6 months of age, to see what's the dose of the vaccine to use, how often to use it, and are there any untoward effects? Are the children complaining of fever or pain in their arm or feeling under the weather after they've gotten the vaccine? Stony Brook is one of the few places around the country for the Pfizer vaccine as well as the Moderna vaccine. In fact, the nearest closest place that your child could get a vaccine on a clinical trial is in Rochester, New York, which you and I know is actually not so close. So what are we doing here at Stony Brook? Well, we have completed the Pfizer vaccinations for 6 months up through age 12. We've given dose 1 and we've given dose 2. And now we will do the 2-month safety look and then give Pfizer all of that data so that they could be ready to submit it to the FDA, hopefully October or latest November of this fall. Moderna, just a little bit behind in that we are completing now the 5 to 12-year-olds this month. We've already had first shots in arms as of last week. And that in September, we will enroll the 6 months to 5-year-olds, complete them also in 1 month, do dose 2 in October for the little kids, dose 2 in September for the bigger kids, do 2-month safety data, and hopefully by December or January, have that data ready to go to the FDA. So some of the things I hear about on the myths from the vaccines are that they can interfere with fertility. Let's break that out for a minute. Number one, vaccines don't cross the placenta. Why is that? Because the placenta is not made by the mommy. It's made by the baby, and it's made to be a barrier. And believe it or not, it's a very effective barrier. So not only don't vaccines cross, but also antibody that the mommy makes to vaccine doesn't cross until the baby's ready to come out. So giving a vaccine to a mom can't get near the placenta, the baby doesn't see it, and it's not effective at all at treating or preventing any infection or disease in the baby. So if you're pregnant, the American College of Obstetrics and Gynecology has said, please get your COVID vaccine. Over the past few months, we've had too many pregnant women admitted to our hospital and to our adult ICUs with COVID. We really want to see none of those. We want to prevent it 100%. So knowing that it does not cross the placenta and was not going to affect the baby would be important information if you're pregnant. In addition, I've always been asked, well, what about other stuff? Is it going to also affect the uterus, or is it going to affect the ovaries? And the answer is absolutely not. The COVID vaccine will not match any receptors on the ovary. It won't match anything on the uterus. It can't attach anywhere, and it will not in any way harm your fertility. On the other side, we do know that COVID infection itself can affect fertility. And a couple of recent studies looking at adult males showed actually significant decreases in sperm count after infection. So both from the women's side, not affecting fertility, as well as the man's side, knowing COVID does affect fertility, we encourage all adults, even those of childbearing potential, to actually get vaccinated. So I want to ask Dr. Chaffee and Dr. Ng, what are you guys hearing out there about COVID vaccines for your teenagers?
I can tell you that you touched upon some of the more common things asked. I mean, we have heard in the past from people who are hesitant on other vaccines, the fertility question. This is not a new question for us. I think that's the most reassuring, is that this is not new. None of what we're hearing about the COVID vaccine are new questions or new concerns. It's sort of, I would call them recycled concerns that we had heard from previous vaccines. So that's number one, and it's super reassuring. And I do tell my patients that. I said, I've actually heard this before. I've heard this when we were talking about this vaccine, nothing to do with COVID. So that's helpful for us. I think that the most common thing, Dr. Nachman, that I hear, and I don't know if Lauren hears it as well, is that this is an emergency use vaccine. And because of that, they're not as confident with it. So that would be the one that is sort of the newest, because all of our other vaccines had already gotten FDA approval. So if you could just speak to that, because I think that's probably what I hear about the most.
Certainly. And in order to get full approval from the FDA is required to go to every single plant that you're making any part of the vaccine, be it the vials, the stoppers, where you're printing up the labels, as well as any part of the manufacturing process of the vaccine. And as you can imagine, that takes time. In addition, the FDA also requires a huge amount of other information that's not traditionally associated with an EUA. And those are longer time points for safety and efficacy. So it would have been impossible to have full FDA approval at the time of the EUA approval, because it wasn't 6 months after those vaccines were administered. We've now hit the 6-month time point because we started vaccinating people in late December, really early January. So there is actually enough time now, with all the millions of doses given, as well as every single plant has been evaluated and looked at and checked on twice. They actually have to go in person to every single plant that makes any part of the vaccine to actually say it's been inspected and approved in order for the FDA to get it. So it's not that there's a lack of information or there's a concern, but rather it's a time element. If you had to go to 20 plants in 20 different countries, you couldn't do that overnight. The inspectors must inspect everything, and that does take time. And they have to document every inspection and everything they've touched and seen. In the past, we never had this issue because it took such a long time to enroll the patients, and it took such a long time for those that got placebo or a fake vaccine in the arm to see if they got disease compared to someone who actually got the vaccine on the clinical trial, that we never had this concern about, is it ready for FDA approval? Because the companies had, unfortunately, more than enough time for the plant inspections to occur. But because of COVID, and every study that was used for the EUA approval had one arm that got vaccine and one arm that got placebo, and everyone, all 30,000 patients for Pfizer and 30,000 for Moderna, enrolled in a month, it happened fast. And unfortunately, there was a lot of COVID happening also. So the infections in those that got placebo happened right away as well. So there was no worry about it would take so long for us to see, was the vaccine effective? So in fact, because of people wanting to get the vaccine and because of so much COVID circulating in our communities, the companies actually had enough data to show that it worked. And that's why they triggered the EUA approval. They didn't have to wait, like the pneumonia vaccine, for enough people over enough time to get pneumonia. It just happened so quickly. So that's why they went the EUA route, because they realized the only way to save lives is to get the vaccine out. And in fact, they did. So Dr. Ng, questions or comments from you about what your patients are seeing?
So it is physical season, and I have a lot of teenagers that are athletes, and, a lot of questions about, the news media about pericarditis and myocarditis in the teenage population with the COVID vaccine. And, parents are asking a bunch of questions and are actually very hesitant to give the COVID-19 vaccine because of this. Do you have anything to say to that?
So first is pericarditis and myocarditis are inflammation of the heart. And what they are is not because there's virus in the vaccine or anything like that, but it's an immune response to the vaccine. It tells us that your body has made a great immune response and it's made some kind of extra antibodies, and that's why we're seeing some of the heart inflammation. So the good news from that heart inflammation patients, and every one of these has now been tracked by the CDC. In fact, the vast majority never got hospitalized. They were seen in their doctor's offices or the emergency room, and they got treated with Advil, and they went home. Amongst those that were hospitalized in the beginning, we actually used different medications, but soon learned that, in fact, Advil was the right medication for the most of those. And all of those have also now been discharged. So yes, we do worry about myocarditis or heart inflammation. On the other hand, it can be identified really pretty easily. And more importantly, it can be treated really pretty easily as well. And the data from the CDC tracking all those myocarditises compared to all the COVID vaccines in that age group show quite nicely that for every case of myocarditis, there's over 4,000 cases of COVID that have been prevented. So when you think about the odds of getting a myocarditis, which is about 17 per million doses given, and think about all the cases of COVID that we could have prevented, clearly the action is on the side of preventing COVID. And that's exactly where we want to be with these young athletes. Because as you know, and I know, on Long Island, every one of those super spreader events we've had over the year was associated with young adults and teenagers. They're hanging out together. They're not wearing masks. And therefore, they're spreading COVID. And with the Delta strain, they're spreading even more COVID. So if we want to prevent COVID illness in them, we are going to have to vaccinate, because telling them to social distance and wear a mask, not working so much. So what else are you guys seeing from parents? What are some of the other questions you're getting?
I think those are the main concerns. I think that the athletes definitely, the parents have honed in on that information more so in males. And I think they're also waiting for the mandates to come down to see, what having a vaccine will do in terms of the fall and attendance at school and quarantine. And I think as that information comes down about if you've had the vaccine, you can perhaps not have the same quarantine, have the same restrictions if you are exposed at a super spreader event. I think those are sort of helping these families to sort of make the decisions, because not only are teenagers at the super spreader events, they really like to play sports. And I think so,
Yep.
Even though there's concern over the COVID vaccine and thoughts about if it could affect their child in a way that they would not like, they also really want their child to be able to participate fully. I think most teenage parents are very aware of the effects of the pandemic. I think they're incredibly focused on all that it's taken away from this age group. And one of the things that will allow these kids to go back and to really fully participate is sort of the community's response to, opening up these schools and allowing sports to happen. So I think that is really on the forefront of most teenagers' parents' mind, is how do we get them back? How do we get them back safely? And let's let them, have the high school, have the college, have even the younger grades that they deserve.
So one of the questions I often get asked is, if my kid had COVID, do I really need to vaccinate them? And the answer is, interestingly enough, you do.
Yes.
So why is that? In Kentucky, they went and they tracked every patient that had COVID and asked them, did you get a vaccine or not get a vaccine? And did you have COVID in the past? And what they showed quite nicely is that if you had COVID in the past and never got vaccinated, you had 2 times the chance of getting COVID again than if you never had COVID and just had a vaccine. So thinking having vaccine in the past, having illness in the past is going to protect you, it's actually not. It is less effective at protecting you than never having COVID and just getting your vaccine. And I think that's important for our student athletes. If you had COVID in the past and you didn't get a vaccine, you're going to get it again. But if you never had it and you have a vaccine, you're going to be protected. So the vaccine seems to be winning on that one as well.
That's great. I think I think the families would be very happy to hear that.
So let's talk about some other stuff for a minute, because we're not just talking about COVID today. We have a whole lot of other infections that we worry about. As you know, from infectious disease, every virus has its season. And in the past, we used to see a lot of flu in the winter and respiratory syncytial virus in the young children, or RSV, also in the winter. With COVID, everything has been turned upside down. And in the UK right now, they're having a flu outbreak. So what advice are you giving to parents now, Dr. Ng, about flu vaccines? What are you telling them?
Well, I'm definitely recommending it. I do have parents that, are very eager to get the flu vaccine this year, especially, with kids going back to school and keeping them safe. We are seeing a lot of respiratory viruses now, even in the summer. And, if you put flu on top of that, then, your child could potentially get even sicker or end up in the hospital. So, I have a great patient population that are very gung-ho about flu vaccine and coming back in September. And like, when do you have the flu vaccine ready? And I do recommend it.
Thanks, Dr. Chalfie. What questions do you get about some of those myths regarding flu or flu vaccine? What are the things you're hearing of, and what do you tell families about them?
Yeah, so the flu vaccine, I think any vaccine that we get a lot more myths, I think, around vaccines that are not mandatory. That's one of the things I've always been able to see, is that pattern. So there's a lot of myths around the flu vaccine, because at this point it is not mandatory for anyone entering school or little kids. So the first thing that we'll hear is that the flu vaccine makes you sick. That's been a very common. We haven't heard the fertility thing about the flu vaccine, but we have heard that it makes you sick. So I like to just sort of explain it out, like I explain all the vaccines, that it's impossible for you to get sick from the actual vaccine because nothing in the vaccine is alive and therefore cannot make you sick. However, just being in flu season or even coming to the doctor during flu season to get a flu shot or to just be in our office, you obviously are exposed to all these viruses. So I think that when people associate the flu with actually getting sick, they're just recognizing that we are working in these seasons to keep them healthy. So getting sick is predictable. Like you said, pre-COVID, we had a little bit better prediction about it. Now we are seeing some of these viruses off season, as we would say, but we definitely recommend the flu vaccine very strongly. This is an illness that affects very young children and the elderly and everyone in between. But the very young children, starting at 6 months, we really feel incredibly strongly, especially if you have parents who work outside the home or school-age children coming in. It's not if you're going to get exposed to the flu, it's when you're going to get exposed to the flu. Once you get the flu in your house, whether it's a mild case or not, the younger children in the house who have not been vaccinated will get the flu. And families only need to have this happen once, and they will become flu converts and they will get the flu vaccine. So I try to tell them how important it is. This is a very large pediatric issue. It definitely hospitalizes children. The younger you are when you get the flu, the more dangerous it is. And the best way to prevent getting the flu is the flu vaccine and vaccinating everybody, not just the children, but everybody in the house from the flu. That's my recommendation. I'm strong into it. I have many kids of my own. I've had the flu in my house. I've gotten the flu myself. And it's nothing that you really want to get sick with. It's a significant illness, and it will really make you not feel well for a lot of days.
Thank you. So I guess the next question that we have is about HPV vaccine, or human papillomavirus vaccine. That's the new vaccine on the block. And the first time some parents hear about it, they're like, when did this one pop up and why do we need it? So why is it important? So I guess the first question is, what is HPV? It's a virus that can be spread from person to person, usually sexually, but can be in other ways as well. And it can, once you're infected, you kind of never really get rid of this virus. It can wax and wane. And we've seen it presenting with genital warts as well as warts in other places. And these are special warts that don't often get treated well because the medicines we use to treat them don't work nearly as well as the routine skin warts that we see in other kids. So for HPV vaccines, Dr. Ng, what do you tell families? What's the earliest age you start talking about this vaccine with your patients?
Well, so first I start off with, what HPV is, which you kind of touched up upon. And I tell parents that, this is a virus that can cause cancer. It can cause penile cancer. It can cause cervical cancer, vaginal cancer, throat cancer, any type or other types of head and neck cancers. And that in itself is probably, why I'm a big promoter of this vaccine. The vaccine came out, or the Gardasil vaccine, HPV vaccine or Gardasil vaccine came out in about 2006. And it covers against 9 different types of human papillomavirus. 2 of those types are associated with genital warts, and the other 7 types are associated with HPV-associated cancers. And like you had said before, the human papillomavirus can be in a person and they may not even know that they have this virus, and they can show no signs or symptoms of infection. And, by having these types in a vaccine, it makes it more protective. So the vaccine is routinely offered between the ages of 11 and 12. It can be given as early as 9. It is for both boys and girls because, again, like I had said before, it can affect men and women equally and cause, different types of cancers. If it started before the age of 15, you only need 2 doses at least 6 months apart. And if started after the age of 15, then you'll need 3 doses. And that's because, you have a better immune response with just those 2 doses at a younger age. Now, the vaccine is more protective before any exposure to human papillomavirus. So it's recommended to complete the series at less than age 13. And I have a lot of parents that come and tell me, listen, my child's not sexually active. They're too young for this vaccine. It's too early. But that is the whole point of giving the vaccine at a young age, is to prevent them from being, before they're even sexually active and before they're even exposed to human papillomavirus. And, it has been a big initiative in our office to improve our HPV vaccine rates because they are particularly low in Suffolk County and New York State as a whole. And the Stony Brook University Cancer Center was recently awarded the Center Cancer Prevention and Action Grant, which is funded by the New York State Department of Health and the Health Research Incorporated program that helps promote education about human papillomavirus and about the HPV vaccine in the community. So I guess the basic thing that I tell parents really is, this is a unique vaccine that prevents cancer, which is amazing, and it's very important.
So it's interesting that our colleagues in Australia have made this vaccine mandatory. And from the time they started that mandatory vaccination of young boys and girls, they've essentially wiped out all cervical cancer in their women. So we have to look to them and say, wow, we should be able to do the same thing. No parent wants to hear that their child has cervical cancer, especially when we know it could have been prevented. So HPV is a great vaccine. There's nothing live in the vaccine. You won't get any kind of warts from the vaccine or any other infection. There's actually nothing live in the vaccine at all, but it is so effective that in Australia, they're not seeing any kind of penile or cervical cancers since they started vaccinating. So I think the lesson learned for us is go ahead, talk to the parents, and please vaccinate those children before they're sexually active so that we never have to worry about those transmitted infections again. So I think those points are really important for our families to talk about and helpful for us. And there are other vaccines that we use that also prevent cancer. People think about hepatitis B vaccine is preventing hepatitis B infection. But remember, the end result of a hepatitis B infection, especially if the child is infected early in life, is liver cancer. We never want to see a child in Long Island or in the US as an adult develop liver cancer. We have the means and the opportunity to give them that hepatitis B vaccine early on and never have to worry about it again. So just like HPV prevents cervical cancers, hepatitis B vaccine prevents liver cancers. And both of those, while they prevent infections, have a bigger picture in mind that we want for all of our children, not to have cancers that were preventable. So those are very important points for all of our families to think about. I thought I would just spend perhaps 1 or 2 minutes to talk about why is the Delta variant so much more contagious than the original variant of COVID that we had. And I figure I'd talk just a minute or two about why that is. The original virus, called the alpha strain for first, actually has 3 parts that have to attach to the cell. Of those 3 parts, only 1 was available to the virus. The other 2 parts were kind of hidden behind the virus. And the virus then needed energy to open those other 2 fingers so that all 3 fingers could attach to a cell and the virus could enter the cell. The Delta variant has all 3 fingers of attachment open, meaning they're available, and the virus doesn't need to use any of its own energy to actually get into the cell. The 3 fingers of attachment are open, and that Delta variant circulates around, it sees a cell, boom, it can attach right away. And that explains why the Delta variant is so much more contagious, because the virus doesn't need to use any of its own energy to enter a cell, make the cell's machinery make more virus, and infect other cells. So our job is to make sure that we cut down on Delta because we want to stop infecting more people. And the only way to do that is perhaps masking both children and adults in close situations, vaccinating where we can, and being very cautious that if you're feeling unwell, don't go to a party. Don't go to school, don't go to work, get tested first. And there's testing through Stony Brook, as well as multiple other venues on Long Island. Because if you do have COVID, the last place we want you or your child is in school or at work. So that's all we had for right now. I think I'm going to thank everyone for tuning into the broadcast. It was very exciting to have everyone and speak with you. And we look forward to developments with COVID vaccine as well as other vaccines. And stay tuned. And Stony Brook is there up front doing the research that will be important for all of our children here on Long Island in getting these vaccines licensed for everyone. So thank you very much. And I look forward to seeing everybody soon again.